To medicate or not medicate? That is the question, really. I think that this is one of the most difficult questions that we have to face as parents in a family with a child with autism, because we hear so many myths and so many potential side effects of the medication. And this becomes a very deeply personal and important topic for many families. So we are faced with very conflicting information. We go and search on the web, and it's a very conflicting information. So today we have Dr. Gupta. Dr. Gupta is going to tell us about the myths and the realities, the risks of medicating children, but also the risks of not medicating the children. She's going to tell us very concrete answers to most of our questions. What happens when we medicate? What should we be asking the doctors? All those questions that we have to find in the web, the answers are here with Dr. Nalini Gupta. Now remember, Dr. Nalini Gupta is a guest in our channel, and she's a very highly regarded specialist. She is an assistant professor in the Department of Speech and Hearing Sciences, and the clinical director, Autism and Developmental Disorders Program of Excellence at the Elson S. Floyd College of Medicine in Washington State University. And for over 2 decades, she has been working with children with autism. And most importantly, she's a doctor who really cares. Please take a listen, because you are going to make decisions with very educated specialists, so you can make educated decisions, right? Let's take a listen to what Dr. Nalini Gupta has to say about this topic. Thank you. Thank you so much for connecting, and listen. Dr. Gupta, thank you so much for being here again. Last time we had you, many people were asking about the importance of recognizing our feelings and our emotions as parents when we deal with this about medication. But before we get started, maybe other people did not watch the previous video. So could you tell us a little bit again about yourself, please?
I'll be happy to. And thank you for having me here to talk about this really important issues that will come up in over a lifetime of any child that may have autism. So it's really important that we discuss this.
So thank you so much. So can you tell us about yourself, please?
Yes. So I'm a pediatrician. I've been practicing for over 30 years. Most of them have been dedicated towards children with disabilities, children with autism, ADHD, anxiety disorders, etc. Currently, I am in a very highly high-speed clinic that diagnoses children with autism in multidisciplinary fashion with other specialists. So that's where my current role is.
It's wonderful. One of the things, as I read your curriculum, which I will share in the intro, is that you see yourself as an educator. And I think that that is so important, especially given the circumstances for us parents with children with neurodevelopmental, whatever it may be, but in our case, autism. So thank you so much. So the question that we want to address today is mainly about the medication. Parents feel very concerned whether they should medicate the children, what would happen. There's so many scary potential side effects that we hear about. And sometimes we feel guilty for medicating their children, because some people say that we just don't want to deal with the situation. I will share. I tried the diet, doing away with everything. My child did not sleep. He would not sleep until he was 4 years old, until I had to decide with the medication. But throughout these years, I tried medication, I tried getting him tired. And so finally, I gave in But I was very reluctant to do it because people made me feel guilty and I did not have the information. So, of course, once I finally decided to medicate him, he would sleep and then I would sleep and things would start getting easier. But having to make that decision is very difficult. So, with that in mind, can we help the parents decide with all that we feel in all the situation with the medication, please?
I am so glad you brought this up because I am in the situation frequently when parents are either asking for medications or I think that they should be on medications. And it's a very hard decision, not just for the parents, but for the providers as well. These medications are likely long term. And as a parent, as a loving parent, as a concerned, responsible parent, everybody should think about it twice before considering medication. It should not be the first option that comes to the table. It has to be a joint decision between the parent and the physician. The decision to start medication. The feelings of guilt I think the minute one becomes a parent, guilt travels with you throughout your life. At whatever age the child might be at, there's going to be something or the other to make us feel guilty. We didn't do this right, we didn't do that. So these are serious decisions, and it is not uncommon to find that the feeling of being judged, the feeling that if I try everything, it is almost as though one is accepting failure before we can consider something to help us. And what I tell parents is that this is no different than if your child at the age of 2 or 3 got diagnosed with asthma or has diabetes. Somehow we accept insulin and albuterol inhalers as those are okay things to do. My doctor is recommending it. It will help my child. But when it comes to things that tend to be not so clear in our heads, like anxiety, like not sleeping well, like ADHD, like aggression, behavior problems, somehow we internalize it to feel like we may be doing something wrong for our child to have that problem. It helps to understand that all of these things are related to how the brain works. And the fact that our child has autism, if one part of the brain is regulated, it is doing things differently, then the other parts of the brain should be expected also that they will show up differently. And that's why we have these issues. So, yes, the medication needs to be a very careful consideration, but with appropriate education from the doctor, with joint decision making, with having clarity as to why are we considering this medication? What is it exactly that the child will be helped or I will be helped because now the child. Having that clarity takes care of some of those guilty feelings or the way we judge ourselves.
Right. Because of course there's also the other way around. There are some parents that just give them medication and without any disregard. So let's ask the questions that many people have contributed to these questions. And so let's go one by one because it is very controversial. And I think we need someone like you with your experience and your actual knowledge to guide us with this. So thank you so much. So the first one would be, what symptoms or behaviors in children with autism typically prompt recommendation for medication?
That's an excellent question. The symptoms can be all over the place. One of the commonest things that we find in children with autism is sleep deprivation. It is just how the sleep cycle is regulated, or the part of the brain that regulates melatonin release is impaired or insufficient, and studies have been done that show that. That tends to be the most common thing that we reach for medication for, because if the child is not sleeping, then the parent is not sleeping. And if the child is not sleeping, their behaviors are going to be worse. and the parent is stressed, their response to those behaviors is going to be not as patient and calm as the child may deserve. So it is a very intertwined. Sleep is intertwined to almost everything in our life. So when I'm teaching medical students and residents, I will say, if you don't fix sleep, nothing else will fall into place. So we have to identify sleep difficulties. That is one of the commonest things that I prescribe. I will usually do some of the supplements before we go to medication. So that's one of the things. The other things that frequently make me think about medications is that ADHD and anxiety very frequently are associated with symptoms of autism. Again, as I said previously, one part of the brain, and I usually make a correlation that if you have seasonal allergies and if you are more likely to have eczema and asthma, it's the same thing with autism or any neurodevelopmental disorder. If you have one neurodevelopmental disorder, you are also likely to have other neurodevelopmental disorders. And ADHD, anxiety, irritability, which leads to aggression, all of those things very frequently can be present in children with autism. And those are the things that we frequently consider medications for. Having said that, medications should never be the first option. I will say that you don't fix something before it's broken. It is our job as physicians to educate parents to know, when is it broken? How do I know it's broken? So when the parents reach that stage where we've tried a few things and yes, it is significantly impacting either their daily life, the child's safety, ability to learn, ability to have a relationship in the family or with peers, all of those things, when they're not happening the way they should, then yes, we should consider medications.
So obviously, even if it's supplementation, it has to be always be controlled by the doctors, because especially in my culture, we're all good for remedies and sometimes they're not innocuous. They can have side effects. So even if we tried some alternative medication, alternative situation like melatonin or maybe teas and all that, it has to be regulated by the physician, right?
Absolutely. It should be under supervision and in partnership with the child's doctor.
Yeah, that's important. So then, having said that, how do you determine whether a child with ASD would benefit more from behavioral therapy and medication or the combination of both?
So there have been a number of studies that have been done where it actually they look at and compare behavior therapy, medication only, behavior therapy only, or a combination of both. In case of things like ADHD and anxiety, it has always been found that a combination of both is the best results. If you do one or the other by itself, the results are mixed, but if you put the two together, you're going to see the most robust responses. But it has only, to my knowledge, it has only been seen with pure ADHD or pure anxiety. I don't think there are enough studies in children with autism who have these comorbid conditions that show one way or the other. It is a very nuanced approach in the sense that if the symptoms are milder or we're just starting to get concerned about that, it is perfectly fine to say, let's try one or the other supplement and start behavior therapy. For things like sleep, there is no behavior therapy that is going to fix sleep. You can have a routine, you can do some of the sleep hygiene things, but eventually it is the medication that is going to be most helpful. So it is a very careful approach that should involve both therapies, supplements, and medications.
Yes, it's very important that you say that. On Rafael's case, which is, I've known of other people, but I can only speak for my son, to help him regulate with sleep, we started giving him risperidone, small doses like that. But we still were trying with the diet because it was like a big, even making me feel guilty if he would have a little bit of gluten and all that. So when he started doing ABA and all these early therapies, we're talking that he was 5 years old by this time. Then even the therapist said, I think that you should consider medication because I cannot work with him. So that's when I believe he started with Alderol. But of course, you had to research and everything. And I do remember another mother. He said, I am not going to give him that because that's going to be poison. I said, I think the doctors know, but I'm just going to have to trust the doctor. 5 years later, I saw her again, and the difference of her child's behavior and mine were very difficult and different. Big loop because they both had the same potential of learning, but hers was just still the same. So I think that that's very important, that you have to trust your doctor, not to, that's why there are so many studies. So, but why would that do that? Because of the side effects. So that takes me to the next question. So many parents fear these side effects. What are the most common side effects? I am going to say this. One of my parents that I work with said that she decided not to give because she read that at the long run, that medication would make the child start salivating too much and then just make him drowsy and change the personality. She did not even try. She just read that and would not try. So I think that we need to really decide this. So here goes the question again. Many parents fear side effects. So what are the most common side effects you see on children taking medication for autism-related symptoms? And in that case, what should we do about it?
So, Elvia, that's a really good question. And I get asked this question every single day. It is natural to be fearful of something that we don't know. Unfortunately, there is a lot of information that is available for parents, and it is easy to get overwhelmed with all of the information and not be able to think through it. I get parents all the time that will say, we have done our research. So reading a few blogs and going on is not research. I say it with humility that if we trust, so if you go to a doctor and say, my child has ear infection, but I'm worried because XYZ fill in the blank. And the doctor says, no, in my experience, I have not seen this ever, or I've seen this maybe in one child in 20 years. And this is how we watch for it. Then that reassures the parent. And you name it, any medication, it could be, we can change amoxicillin to something else. So if it is a careful discussion with the physician and not just reliance on what we read online, we trust our physicians to make so many important decisions for us. Fear can be paralyzing, but the only way we overcome our fear of side effects is by having an honest conversation. What do we expect to see? Why are we doing this? So it is important. Here are the questions that I would like the parents to get very clear in their head when they are going in for a discussion about medications before I even go into what side effects can be, because every medication is different. And I can tell you the common ones, and you can have a child who will have the uncommon side effect, right? It is anybody's guess how our bodies react to something. The questions to ask are, what exactly are we hoping to get by doing this medication? If it's sleep, the answer is simple. They're going to sleep better. You're going to sleep better. If it is ADHD, anxiety, irritability, aggression, severe behavioral meltdowns, what are the target symptoms? The key word is target symptoms. What are the target symptoms that this medication will help with? Once you know the target symptoms, and I may be jumping the gun, but once me as a physician and you as a parent know that this is the target symptom, you can decide this one is really bad. I would love for it to not be there or to be much less. Then it reinforces in our brains, what are we after? And why is it important? instead of saying we're just going to treat this or that, the label, we are not treating the label, we are treating target symptoms of that label. So once we know the target symptoms, then you say, now what are the side effects? And then me as a physician and a parent have to decide, are the side effects more than what we are hoping to getting rid of the target symptoms or improving target symptoms, or are they acceptable? And it's going to be a two-way street. So the way most medications should be given is that you start really low dose, especially in children with autism, because they're going to respond differently than children who don't have autism. So we start really low dose and we go really slow up until the point where the doctor and the parent say, I think I see what I need to see. I think I am at the place where we have minimal symptoms or it's not impacting anything big and we are in a better place than we were before we started, or we keep going till we see side effects.
I think that's very important that if I'm understanding correctly, the side effects are potential side effects. Not all children present those side effects. So it's potentially it could happen with the studies, and sometimes it's like 10% or less. So it's like 80% of children don't have these side effects and 20 do. So that's when you outweigh the pros and the cons, right? Is that correct?
Yes, that is correct. And I like to say that if it does, the percentages are good to look at. But if my child is the one that had this uncommon, really bad side effect, then it doesn't matter if only 30% of people get it. I am the one dealing with it. My child is the one dealing with it. I think it is important at the offset to decide what I am hoping to achieve is a big deal. Now, the side effects may or may not happen. You're absolutely right about that. But if we are careful, if we are starting low and going slow, then even if the side effects shows up, it's going to be a milder version of it. And as a parent, if I'm educated to say, what am I watching for? And as a physician who's in tune and not just saying, here's the medicine, come back in 4 months, but here's the medicine, let's talk about in 2 weeks how Johnny is tolerating it. Are you seeing something? Let's meet in the other 2 weeks. Let's meet a month from now. And closely monitoring it, then it's very likely that even if there are side effects, A, it'll be small, B, it will be earlier detected, and C, we can make decisions whether we treat the side effect or whether we try something else before you start seeing big responses. So that is, I think, going about it mindfully will allow the parent not to be so afraid.
Yes, that is obviously the fear of the side effects are always like a ghost hunting us. Before I go into the next question, I'd like to say that the risk of long-term medication. So Rafael was medicated with risperidone for a long time and methylphenidate. But then he started getting early hypersexual. So I was told that it could have been a side effect of that medication, of the methylphenidate. So we changed to Stratera and we started giving that. And for a period of a year, he was vomiting and just vomiting. So I took him to different doctors, especially with the stomach, to see why he was just throwing up like that. And it was a year until I went back to my original doctor and I said, he's doing this and I don't understand, because he was even treated, especially stomach diseases, with gastroenterologists, and nobody knew. Nobody even asked if it could be. Now, the doctor, being a neurologist and having his experience, he just took out his book. Here, potential side effect for that is that it can upset the stomach. So for a whole year, I was dealing with that side effect. And then we went back to methylphenidate, no problem. So sometimes even other doctors need to see, because my pediatrician, neuropediatrician was giving me that. So that is something this long term. But the reason why I was so concerned is because I was told that risperidone would potentially maybe have them develop some kind of breast instead of. So all those things we don't really know. We believe it. So this goes to the next question, which is what are the long-term risks associated with using medications like risperidone, methylphenidate, which is the most common, or whichever other you want to add.
So I think, and you had asked me this also in the previous question, what are the side effects, right?
Okay.
So what I can do is to
Long-term?
demystify. I can talk medication by medication because they're
Okay.
not common. They're not the same for every medication, right? So let's start with sleep because I can talk for 2 hours on sleep and say, if you don't fix sleep, nothing will get fixed.
Yes.
So medications for sleep typically are fine. You're not going to see a lot of side effects because it's a once a day dosing, whether it's clonidine or an antihistamine or whether it's melatonin. Sometimes with melatonin, children can wake up really scared because I have heard it that they can have vivid dreams. So, and again, children can wake up scared for no reason at all. Even if you don't give them melatonin and they wake up scared, the response is going to be the same. You reassure their children. Having bad dreams on something does not, in my opinion, count as a side effect. We just have to be patient. And sometimes they outgrow it or it'll happen for a few nights and not happen the rest of the night. So medications for sleep are fairly without any big side effects. One shouldn't really think or overthink fixing sleep because that is most important. And they impact the child's ability to learn the next day, to behave the next day, to listen the next day, to be patient, not fight, not be aggressive, all of that. So sleep is easy. Then we'll talk about ADHD. The ADHD medications are stimulants or non-stimulants. Almost all ADHD medications in the short term and long term will impact sleep in the way that the child will not want to sleep. And that's why fixing sleep before that is so important. Most of the stimulant medications like Adderall, methylphenidate, whether short acting or long acting, they will impact the child's appetite significantly if we are using the correct doses. And outside of sleep and appetite, what sometimes stimulant medications can do is that if you have a child who has ADHD but also has a little bit of anxiety, it can unmask anxiety because now they can focus on what is really bugging them. So you might see a child who may suddenly start having tics because they're anxious. They might suddenly become very phobic of certain things because they're anxious. And that truly, in my mind, is not a side effect. It was always there. It is just getting uncovered because the brain is able to focus better. So those tend to be the short-term side effects. Now,
when you mentioned that it could affect appetite, either does it make them eat more or eat
less? They eat less. And there are ways around that. There are ways around it. So most of the studies will say that if a child has been on stimulant medications over a lifetime, they may end up half an inch shorter. I'll take that half an inch shorter. Child can focus, attend, and learn. So it's a conversation to have that I'm going to start the child on stimulant because XYZ behaviors need to be improved. It's making your child unsafe. It's making your not having friendships. It's making your child be in suspension from school or being put in
the family dynamics as a whole.
So we will take the stimulant, but then if the side effects happen, we may need to address those. As in, if the appetite is suppressed, we need to figure out they're going to be the most hungry at 9 p.m. And you can't be that parent that says, dinner was at 6, sorry. Now, if they're hungry, they're not going to sleep. So you may have to fix them a little dinner at 9 p.m. and also see if they'll eat at 6. And that will keep the caloric intake where they don't lose too much weight.
Mhm.
There may be supplements that might be needed to help decrease the appetite. We may need to change the timing of the medication such that the child is eating at least 2 full meals in a day. So all of those things come after a discussion with the physician, and your whatever blog or whatever website, they're not going to talk about how we address that. They're just going to scare you into saying, my child will stop eating and they will stop sleeping, and therefore I shouldn't do this medication.
Right.
There are multiple ways around that. And if push comes to shove, and I've tried everything in my toolbox to help, and if the child is still not eating, I will sometimes reach out for another medication that will improve appetite, because I want those target symptoms that are disruptive to the child's daily functioning gone. I want the child to succeed. And if it takes a medication to improve their appetite, that's a small thing to do because we are changing big things. So those are the common short-term side effects. Now, I'll tell you what the long-term side effects are. I love talking about it because not a whole lot of people are aware of this. They have found that if a child has ADHD and it's untreated because of whatever reason, parents don't believe in it, they tried a couple things without the proper education, freaked out when they saw the first side effect and said, I'm not giving this, right? Studies have found that untreated ADHD versus treated ADHD. And they followed children, little to about 18 or up until adulthood, I forget, higher risk of substance abuse, alcoholism, suicide, depression, anxiety in untreated ADHD. And in treated ADHD, better learning, better friendships, less of all of the things, less substance abuse. And they took a set of kids, same in the age group, and they just followed them. So one has to think about what happens long term when you treat with ADHD medications. And I tell parents that a child's success is determined by their self-worth, their sense of self-esteem, and small successes.
Right.
If we are taking away the roadblocks to their success, less impulsivity, more focus, more attention, better relationships, then the child is going to feel more capable and successful. If we allow the things that are getting in the way to continue because, they will have to figure out, and that is life, and they learn to problem solve. It is the same as saying, my child has asthma, it's a high pollution day, but keep running, kiddo, you can do it.
I like that. I very much like that. Because obviously, since it has to do with the brain, we are thinking that if we medicate them, we predispose them to taking drugs. On the contrary, because we're helping them regulate. I think that is a very common fear. And I like how you're saying the higher risk, because especially women as go untreated and without ourselves. Personally, I was just diagnosed with ADHD 2 years ago. And so now I understand why different types. So now, of course, I started taking the medication because I needed to function better. And just recent. So I think this helps anyone. And as long as we are very regulated. So thank you for that.
I'm sorry to interrupt.
Please.
I'm going to just in the same tone, we talked about the stimulants. I didn't touch upon anxiety medications.
Oh, please.
Again, some short-term side effects, not a huge long-term side effects. Weight gain is one of the things of anxiety medications, SSRIs. But I'll go to what we call them atypical antipsychotics, the Risperdal and the Abilify. Those are serious medications. Those do not need to be taken lightly. Again, the benefit should always outweigh the risk. But with those medications, you cannot be without physician supervision because they can have some very serious side effects that sometimes can be irreversible. So I'm just putting it out there. I'm very careful when we prescribe that. very careful about educating both parents and having closed system of monitoring progress. So just want to say it out there. Now we can go on to your next
Yes,
question.
no, thank you. I think that's very important. And I think in the education part, it has to do with in some person, I'm just going to take him off the medication without asking the physician. So that's just as risky because obviously the brain is functioning with a stimulant and you just take it off. It's like, sorry, no water for you. You know? So that's also very delicate. Thank you so much. So I think that in a way we mentioned about this avoiding the medication. We have talked about that, but what would you say to a parent that says, I'm just going to give my child, I'm going to try with ashwagandha and I'm going to try with rhodiola and I'm going to try with melatonin? What would you say to them?
I would say that there is nothing wrong with it. Please do it for 2 months. And if you're not finding, because your child has lived for however long before we decide to try stuff, right? Another 2 months is not going to make or break anything.
Mm-hmm.
By all means, try it. But you have to be clear as a parent in your mind, what exactly do you see? Better or worse is a very subjective thing. What exactly do you want to get better? So we can give 5 supplements, and I do think that they work and they help. By themselves, maybe not so much, but they allow me to lower the dose of medication I need. So I like supplements, but it has to be a very mindful journey where is it costing $500 a month? Then please don't do it.
Exactly.
You can use the $500. I can tell you 5 ways to use it for your child. If it's costing you $50 or whatever, or if you're a multimillionaire and 500 doesn't matter, then what you need to do is set a timeline. I'm going to try it for 3 months. These are the symptoms that it is supposed to help with. And after 3 months, I'm going to come and talk to the physician saying, I see 10% improvement, 50%. Oh, this is all gone. What's left over? What do we deal with it? So almost in a very scientific way. You cannot say that I started doing XYZ and he is so much better. That means nothing to me. You have to know what exactly is helping and for what. And if you find that the child is better by 30%, then you only have to then focus on the remaining 70%, right? And the parent is clear that the improvement was there, but only this much. This big elephant is still a problem. And I've tried this. Now let's add something to it. So that's what I would tell the parent to do.
So that takes us to the next. And I think this is a big warning for those parents that I've been browsing down Facebook and all this, and I'm going to say the word quacks and really abusing the situation. And they to give this magic trick. So we're going to touch on that, but I think that you just hit that on that one. So let's talk about the diet. Is there a specific evidence supporting the use of restrictive diets like gluten-free and casein-free to improve ASD symptoms? And can diet substitute medication? And I'm going to give you the context. When I started, of course, I wanted to do everything right. And we did try the diet. So because they told us that it would be synthesized as morphine. That's what I was told. And that's why he had such a high tolerance to pain and he could hurt himself. And so to change his behavior. So the whole family had to be on this diet. So that meant no spaghetti, no cakes on birthdays. So we did it for over a year. It was very stressful. In our case, once he got into school, I wasn't going to tell him, you can only give him this kind of foods. I said, you just feed him. Whatever the other kids eat, it's difficult enough to also be making sure that he would have to have that diet. And frankly, there was no change. That's my experience. But all I can say is I tried it, check. What can you tell us about that?
So I'm glad that you already took care of some of the things that I was going to say through your personal experience. Diet. So there are no absolutes. Just like autism is very black and white, everything about autism and its treatment is very gray. There are some children who may have food sensitivities. So those are the children who will have frequent loose stools, diarrhea, or severe constipation. And when you are hurting or when you're uncomfortable and you're not able to express yourself, it shows up as behaviors in children with autism. So those are the children it's worth considering diet limitation. It's not a blank check. It's the same approach that one would take to supplements. I said, decide what is it. If the behaviors are bad, and if a family really wants to try gluten-free, casein-free diet, have a timeline. Have a 2-month or 3-month timeline to say, we will do this. We will do it the way it should be done. It is really hard, as you've said from your experience, because the whole family has to do it. It is also really expensive because all of the foods that are considered gluten-free, it's become a fad, are twice the price of everything else. So not only is it hard, it is expensive. It's going to make a difference to the family budget. And if we are going to do it indefinitely, then why are we going through the pain of it? So 2 months, 3 months, if the diarrhea improves, if the behaviors improve, if the child is not so miserable, maybe it's doing something. Can we continue it? Is it gluten only or gluten and casein? There are families who swear by it, who may have family history of sensitivities. And those children would be helped whether or not they have autism. Just that with autism, because it shows up as big behaviors, little irritations, little body discomfort will show up in a big way. It asks for more attention. So yes, it can help some people. It is not something that everybody needs to try. So if I say all families need to try, no, that it doesn't work like that. You have to curate it. You have to talk. Look, this is a child who may benefit from it. If I'm going to try it, I'm going to try it with full knowledge of how hard it's going to be. And then we will set a time to say, let's reevaluate and see if it worked or not. And that time cannot be 5 years. 2 to 3 months, most of the things you should be able to tell. So that is as far as diet goes. There is one thing that I recommend almost all families who have children who have neurodevelopmental disorders. There is enough studies now where I can confidently recommend refined sugars, processed food, and food dyes. They are bad for everyone. They are especially impactful in young children with neurodevelopmental disorders, in their ability to regulate their emotions, in their ability to focus, attend, concentrate. It makes a huge difference. So nobody should eat that stuff anyways. But children who have neurodevelopmental disorders should not get. Now, it's not an elimination diet, it's a restrictive diet. I don't ever want any child to not have anything sweet ever. There are certain things, there are celebrations, there are special occasions. They need to be celebrated. Every meal does not need a dessert. That's the difference. So by all means, have your birthday cake. Just take off that blue icing from the top of the cake.
Right, because of the ice.
Yes. If you're planning your child's birthday, do it a brunch or a lunch instead of dinner so they're not eating sugar and they're not sleeping the whole night. Do it earlier. So those are the kind of things. So food dyes, refined sugars, processed foods typically make young children's regulation, the brain regulation, it's impacted meaningfully, where it is fair to say that no dyes, limit sugar, and avoid processed foods.
And that should be generalized because, I mean, yes, like you said, it's a brain killers, literally, right?
Yeah.
So the parents obviously would need to be convinced, and it's a family dynamic because sometimes it's the parents' diet also that is helping in the family dynamics as a whole. So how do you involve the parents in the decision-making process around the medication? And how do you ensure that they feel informed and empowered? Because I can tell you, I would think that it was okay to medicate, But of course, extended families, no, don't do it, and that. So it came to a point when I said, my family, my decision. But then even with the father, it was a little difficult to make that decision. So how do we involve them? How do we feel empowered so that we decide with conviction that is really best for our child?
So I am of the opinion, and I've learned during my decades of practicing, and I've come to the conclusion that any medication decision, I will take an hour to discuss with the family. I will say, bring the grandparent. So it's important for physicians to ask the question. And since physicians may not be watching this, it's important for parents to know, to tell the family or tell the not family, physician, I might be okay with it, but dad is not. I might be okay with it, but my mom makes me feel terrible. And my child is watched by them when she's on school break and they won't give the medication, right? So those are things that impact the child directly. And it is okay to ask the physician, can I bring along? Now, you can't bring along 10 family members, but the most important ones usually tend to be grandparents.
My family.
A grandparent, your partner, your spouse, the other parent, right? Sometimes you may have another spouse, one may be divorced. So there's two sets of families, and the child is spending 2 days here and 2 days there. And it is unfair to the child to get medication in one home but not the other. It is dangerous for the child to get the medication only in one home and not the other. So all the stakeholders, call them stakeholders in the child's life, who have any say or direct involvement or direct responsibility for the child, need to know and be in that discussion about medications. So if a parent is requesting it, I will not prescribe any of these medications without the other parents, one spouse, two, any grandparents. They all need to be there. Not everybody physically needs to be there. They can join virtually by Zoom, like you and I are doing. So everybody hears the same information. Everybody has an opportunity to ask the questions, discuss their viewpoints, why they think the way they do, and what should they expect from the medication and why we are doing this, right? So it's not just making the parent requesting the medication their life easier by not having to answer to everybody. But what it's doing is, if I tell you something, Elvia, and you communicate it to a third person, it is that game where some of the information is going to keep getting lost the more number of people relay that information. So patchy information is not good information. So I want everybody around to say, this is the reason I think this medication would help. This is what we are targeting. This is what the side effects are supposed to look like. This is what you as a parent need to pay attention to. This is when it's okay to stop the medication if I'm on vacation and you can't reach me. So that is the most important discussion before any medication is prescribed, especially for all the things that we've just talked about.
So we need to ask the physicians that they be willing to do that, right? Because yes, you just touch check and it's very hard. Yes, because they don't need it. So I know. So what signs should parents look for to know whether medication is working and adjustments? Because, so for example, my son, he's been taking risperidone for about 10 years already. Yeah, nighttime, and we haven't needed to change. I mean, we started with 0.5. First it was in the morning, then in the evening, and then we decided to change the medication in the evening. He's been taking 1 milligram just to help him sleep, and we haven't had any changes. So it is very tempting for me, especially when I have in Mexico when there was no follow-up, and I just knew that he had to have that. So I would just continue buying it because the doctor said they didn't say how long or whatever. So I think that sometimes we just don't want to go back to the doctor and just continue giving them the same medication. So I think that that's very delicate too. So please tell us, what are the signs that we should be looking at?
So the signs are those target symptoms.
Yes.
that have to be identified before we start the medication. What exactly are we hoping to achieve with this medication? And then how do these target symptoms show up? So if we're treating anxiety, how are we going to know our child is less anxious? Are they less irritable? Are they having less temper tantrums? Are they less afraid of the bees? Are they less reluctant? Are they willing to try new things? So that is a translation for a parent. And you have to ask the doctor, what am I looking for? How will I know this is working? And when those do we stop? Now it's working. It's been 2 years. How do we still need it? That's a question that has to be asked every few years. Do we still need it? How do we go down on it? Can we stop it abruptly, or do we have to slowly taper it off? That is how you know when to stop it if it's working. And if we say start low, go slow, then we will know whether it's effective. And if it's not effective, then you know it sooner than later without waiting 4 years for it.
Yes, exactly. Thank you. But for adjustment, for example, I asked if he was very anxious and if we were going to go on a trip. The doctor said, well, in those cases, usually you can put 1.5 because he's going to need more help, but with the doctor's permission. And then we have to know what to look for. Thank you so much. So now that takes us to the next question. When should the child not consider to have any medication? Is there a situation when the child says, no, no medication? Is there a situation like that?
No, not in my mind, no. And medication is not one medication, right? There's an array of about 10 different medications that are used for different purposes. So in my mind, I don't know any child who needs no medication because we don't know what the medication are for. So I think just in the question form, I would tell you that there is no child who needs no medication. Now, there are children who may have a serious side effect with any one of these medications, and then that medication should not be given again to that child. But there are alternates to that medication. Sometimes what happens is the child may not tolerate or have a side effect to one medication in that category of medications, but may do just fine with a different medication. And to give you an example, for ADHD, some kids, you will try methylphenidate and they will have side effects and they'll be worse off than they started. And you take it off and you give them a break and you start Adderall. And oh my God, this is godsend, right? It's the same category, but two different medications. It's the same thing with the anxiety. It's the same thing with Abilify and Risperdal. One or the other should work. Now, if you've tried two medications in the same category and it's not working, either we need to change or look at the diagnosis again. Is there something else that's going on? Or we just don't do that category of medications again. But because one works doesn't mean that the another one won't work.
I think that there was a Vyvanse to help him with the eating disorder, right? So you mentioned at the beginning that whenever the child is sleep deprived is a must. But I know in the comorbid part, there is epilepsy. So when a child is having, I think that is also, is there a risk of combining the medication?
That is, so the neurologist is going to decide what kind of seizures and what medication is being used. And the neurologist should be aware of everything else the child is taking. And we usually check. There are now, we don't have to keep it in our head. There are apps and tools that we have to put 4 medication together and out pops the answer, no, don't do this with this, or don't do this with the other one.
Oh, wow.
So that is something that should be checked, especially if the child is on multiple medications. Because if you're doing one for seizure, but the other medication is increasing the risk for seizure, then there's no point. So those are decisions that the physicians regularly and routinely make when we are starting a child on a medication for anything, whether it's seizures or any other reason.
Thank you. Thank you so much. Mm-hmm. I really wish I had you 10 years ago. Where were you? Is there anything else you would like to add?
I would like to add that it is important to remember that you as a parent and the physician who's treating your child have the same goal, for the child to live their best life and to be as successful as they can. And if it sometimes takes medications to get there, then we do a disservice to our children by not allowing them those medications because of our anxiety, our fears, our beliefs, and who we are choosing to listen to. It is a dialogue that should be had with the physician. It's a two-way street. Sometimes it takes months for us to come to that place where I don't want to give my child any medication. I don't know how the brain will change. And I tell parents that the brain changes anyways, with or without medication. If your navigating life is hard, the child is going to feel anxious. The child is not going to want to engage with things that are hard for them. The child is going to feel depressed later on. Child is going to try alcohol and street drugs to feel better. Trade that with a medication that actually allows them to have more success. You've got a different trajectory for that child then. Then you've got a child that can navigate the world a little bit easier, can make friends, can see you as a responsive parent instead of always frustrated, low patience parent who is always stressed because of their behavior. And that changes the trajectory of that child's life. That is how important sometimes these medications can be.
I understand it. One of the doctors, my doctor said, have you ever checked on the side effects of Tylenol? And what the long take? You give Tylenol without asking, and it can be even worse. And because of the type of medications. So we just need to really look things up with our physician. Thank you so much. I think that it's going to be very helpful for those families that are starting with this journey. And once again, and I hope to have you back soon. Please, thank you so much for your
Thank you,
generosity and your
Elvia.
time.
It is my pleasure.
I very much appreciate it. Thank you. Wow, how about that? That certainly shed a lot of light. There are many considerations that sometimes we take for granted, but they are going to impact the prognosis of our child. Remember that one thing is the diagnosis and another is a prognosis. So how the decisions that we're going to make are going to impact on our child's quality of life. This is how important these kind of decisions are. So I very much want to remind you that every child is different. Okay, so ask the questions, but always with professional help. Don't say like, oh, I'm going to take it off, see what happens. Please don't do that. It is very, very delicate. Okay. Sometimes we ask, I get asked like, what are you medicating? Like, it's like physical remedies. One child with autism, and then you only know one child with autism. Every case is different. So it's okay to ask around, but please, when you make the decision, make it with educated professionals in the field. All right. So thank you so much for listening. Please write your comments. What did you think about it? And remember, you are not alone. God loves you, and I'm praying for you. Please pray for me as well. Thank you. God bless you.